They give you a flu shot, prescribe your meds, they may even try to get you to exercise. But there is a more personal component to being a good medical provider, too. Teaching kindness in medicine. Tonight, On Call with the Prairie Doc.
Good evening, and welcome to On Call with the Prairie Doc. I'm Dr. Jill Kruse. Physicians take the Hippocratic Oath when they begin their practice, and one of the promises within that oath is, first, do no harm. Another way to say that might be to be kind. First, let's take a look at this week's Prairie Doc quiz question. It's a true or false question tonight. If a physician has great skill and knowledge, is it as important to be kind? True or false? Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of Dr. Holmes' essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. We answer your questions about kindness as they are called into or sent to us via Facebook or email. Calling questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight are Dr. Jerome Freeman, Professor and Chair in the Department of Neurosciences at the USD Sanford School of Medicine and Sanford Clinic Neurology, and Dr. Mary Nettleman, Dean of the USD Sanford School of Medicine. Welcome. Dr. Nettleman, please tell us a little bit about kindness and what the med school is doing on that front.
Well, this is a new venture for us, and we're very excited about it. We hope to put kindness at the center of the medical school culture. We think that people do want a doctor who's both competent and kind. And I think this is something where we build from a very strong platform. We already have kind faculty, and people in South Dakota are inherently kind. But we want to make it an intentional thing, where people, especially physicians, stop and try to think about how to treat a patient kindly, or recognize it when they are treated kindly. So we want to make it a real centerpiece of the medical school.
Wonderful. I know I've heard it said, people don't care how much you know until they know how much you care.
Well, that's a good way of putting it. It really is. And so the nice thing about kindness is if you do something kind for me, I feel better and you feel better. So it's not, you can feel sorry for someone and you could do a lot of things, and all those are very good, and you can feel compassion. But kindness is something that really elevates both people. And as we've said in our noisy, confusing lives, it's good to take a step back and really stop and think that, that person did something kind for me, or I'm going to be able to do something kind for them, and to pay it forward. And if it becomes intentional in something as important as the practice of medicine, we hope that we will have an even better tomorrow in medicine.
Excellent. Do you have anything that you'd like to add, Dr. Freeman?
Well, I think kindness is important in all aspects of life, but particularly if any of us are sick. I mean, if we feel more vulnerable, more uncertain, and I think the value and the need for kindness is magnified in that setting. Patients and families, I've found, are just incredibly grateful when they perceive us as being attentive and kind. And so it's a great opportunity, I think.
So is kindness something that you look for in the application process? Is it something innate or something that you coach?
Well, it is all of these things. Because kindness, as Jerome would tell you, it's what you do and how you do it, right? So it is an action verb. You can't really ask on an application, are you a kind person? But we're going to develop questions for our incoming medical students, for example, that ask them to potentially describe a time where they've been treated kindly, or they've treated someone kindly, or what kindness means to them. It's something that is a work in progress. You can also, we don't really teach people to be kind, right? Because kindness in itself is an action. Right. What we're trying to do is elevate kindness by giving examples. And so we do have many pieces in the curriculum where kindness is discussed, or where we intentionally focus on kindness to try to make it a thread that runs through the entire 4 years of medical school. So we are working on that. We start from the very beginning. At application now, students are receiving a brochure explaining that we have this kindness program, talking about where it is in the curriculum. And then as they enter the white coat ceremony, which is the first ceremony they go through where they are recognized as physicians in training, we discuss kindness at that point. We have many other classes, Healer's Art, where people reflect upon why they went into medicine and what medicine means to them. And Jerome has done wonderful things with ethics and with the other pieces of the curriculum that we have that really we try to elevate it, if you will. I think it's very important. It's important to realize that we're starting with people who are inherently kind and who want to do kind things. It's just we want to make sure we keep that when they're out in practice.
Excellent. All right. So when you have students and you're trying to make them be mindful of what they can do, how do you feel that interplays with their first interactions with patients? Does that kind of set them up for building a practice and learning how to deal with some of those difficult situations?
I think it can, very much so. We remember when we were medical students with our very first patients, and you're just trying to get everything right? I mean, you're just trying to remember how to do a physical exam and whether or not that sore throat is strep throat or anthrax. And I mean, you just really have, you don't have your feet on the ground, and it's easy to forget about things like kindness. And because you're just trying to move forward, and then you're just trying not to hurt anybody, right? And you don't realize how much you can help by being kind. Our students, some of our students, their kindness is remembered for years by patients. Remembered more than the attending physician, sometimes, who actually treated and cured the patient. The student who sat by the bedside, who brought in the extra book for the patient. These types of acts, I think students don't realize how much they really, really mean when someone is sick and is in a vulnerable position. So I think it will actually empower the students in a way.
Excellent.
In the white coat ceremony, I tell a story. Stories are so compelling to all of us, but I tell a story of a patient who was pretty sick, and he was in the acute hospital and then on the rehab unit for a couple of weeks, and he was getting ready to leave, and I went with a student up there to say goodbye to him, and he shook my hand and he was very grateful to me, and then he looked at the medical student and he said, "But you saved my life." And he meant it. He meant it because she had been so attentive. She'd been going up to the unit a couple times a day. It made a huge difference to him. And I use that story partly to show students that it's not like you're just kind of coasting until you graduate and then start making a difference in people's lives. You do it from the beginning, every contact you have.
Excellent. Well, let's hope these students can start rubbing off on our attendings and make us better people as well.
Well, and I think that will happen. I think just for attending physicians and students to even be thinking and talking about kindness is a huge step forward. Mm-hmm. Because I find if I'm talking to a couple of students about kindness and then we go see a patient, I'm very attentive to how the interaction goes. I want it to go right, and I want to model for students how I want to try to be what they would want to be in the future.
So many of our faculty are practicing physicians in the state of South Dakota. That is their entire day job, and they also are kind enough to take our students. When the students graduate from medical school, every student in the country takes a graduation questionnaire. And every student rates their clinical faculty. Were they compassionate? Did they have empathy? Were they mean? Our students rated our faculty and consistently rated our faculty above the 90th percentile nationally in compassion, empathy, taking time with patients, being respectful. There's actually not a question on kindness, but these are all elements that also reflect values of kindness. So our students already think our faculty are very good. We're trying to make it intentional. So I sent out a letter to all 2,000 teaching physicians that we have, and I asked them to mention kindness to the student, and to mention it when they see a student being kind, or to relate a story of when someone was kind to them. So we're just trying to create the buzz and the intentionality of kindness.
Yes, and kindness can take so many different forms in medicine, and a lot of times it's not even the getting to the right diagnosis. It's getting into that relationship with the patients. I know something that I always try to teach my students is find the fear, because people come to us with a lot of fear. There's a lot of things that they don't understand. Me going to the office, putting on a white coat, being around people who are ill is routine and every day for me, and that can be very easy to forget that it is not routine or every day for everyone else. So you can forget how important it is to be kind, because they're in a very vulnerable, scary situation. And so if you can find that fear, that's where you find that opportunity for compassion. What do they need to hear from you to make them feel comfortable and at ease?
And to extend on that, sometimes a patient is sent to me with a certain problem, but that's not really what the patient's worried about.
Exactly.
And so finding out what the patient really is concerned about is getting to their fear, as you mentioned.
Mm-hmm. And that's where the kindness is.
Yeah.
If you just brushed through and said, well, I went through my checkbox of symptoms and exam findings, and here's your prescription, and go out the door, you may have done a very technically accurate and thorough job, but were you kind?
Right, and I think you've said some very good things, and it's obvious that you really understand and practice this value. Because kindness is not just the absence of meanness, right? It's not just that you're not nasty to somebody, it's that you actually do something that is intentionally nice. And it can be small things. That's what I like about kindness. It doesn't have to be monumental. It can be something as small as, taking the time to notice that they're crocheting, and to talk to them about that. It can be something that puts them at ease, and it can be something much bigger, like sacrificing some of your own time that should be given elsewhere. So it has a lot of things, and I find too, in my practice and in my work, that by focusing on it, I notice how many times people are kind to me. Sometimes the sickest people, the ones that you think are most in pain and suffering the most, take time to ask, well, but doctor, how are you doing? And you're thinking to yourselves, think of all the stuff you're going through, and you're worried about me. We're surrounded by kindness, and sometimes with all the hoopla that goes on around, we don't notice it. And I think that's what we're trying to make more noticeable.
Yes, I think that intentionality, it's kind of as soon as you start looking for it, you keep finding, and it becomes this continually self-fulfilling prophecy where you look for it, you find more. So I think this is wonderful that you guys are intentionally focusing on this, and not just the science of medicine, but the art of medicine. So that's fabulous. Hats off.
Thank you. I will say our students, you want a doctor who's competent as well as kind. Our students are highly competent. And I mean, they just took their boards. Over 75% of them scored above the national average, and only half, statistically should have. They're very competent, and they're very nice. And when they come to medical school, we find that they have a very high sense of altruism. They are in it for the people. And, medical school's tough. And sometimes people beat that out of them, and we hope kindness will be better and help us with that.
Yes, excellent. Well, kindness is both an innate and a learned skill. What are the ways to teach the practice of kindness?
Kindness is a virtue that, we talk about it a lot, but to me it's something that I think every human being kind of would strive to being kind, or we have that natural goodness to want to do that. But sometimes we get caught up in our everyday life and hurrying us and doing things maybe a quicker way than a kind way. You see puppets behind me. My kids do a lot of, sometimes they're not able to put their feelings or what's happening in their situation into words, but they can use puppets, or they can use the dollhouse or sand or any of those things. And so then I am able to model lots of things like, oh my gosh, that Mr. Rabbit was really just in trouble. I wonder what we could do to help him. And we try to stay in character with the puppets, and we learn a lot through play, because I believe that play is a child's language. So I probably do more teaching here than maybe a classroom teacher has a chance to do. I don't think kindness is something that yes, we have to teach it, but I think we model it, and we have that opportunity every day. And if I could send a message to everybody, is we all learn from each other, but particularly children watch everything we do. And so if we're at the grocery store and we hold the door open for somebody, or if we get a can of soda and leave 25 cents in the little slot, or anything like that, we can show children or show people every day that kindness is something that we want to share. I know you can find data for anything, but there's research now that's saying if we were to interview kids, that kids who feel like they're kind or have practiced kindness or know that value, they tend to do better in school, they tend to feel better about themselves, they tend to be less of a bully and feel like they're bullied less. We all want to be in a community and we want to be connected. And by talking about some of those virtues and values, I believe that gives an opportunity for children to see it in their parents and in their grandparents. The holidays are coming up. That's a perfect time to sit around the table and go, when can you remember a time that somebody was kind to you? Or if you were to list 3 people that you would put in your kindness basket, who would they be? And then kids start to think about it. Plus they see, oh gosh, Grandma and Grandpa have 3 people. Or they remember something way back when somebody was kind to them. And I think if we could back up and go back to those values of kindness and being connected and a sense of community, we would be in a better spot. And our kids might not be so rushed, so anxious, so feeling like they need to perform. So kindness is something we don't have to buy. We don't have to get at the store. It's in our hearts, and we can pass it on, and we'll build a better community.
This is your program, and your questions are the key to the direction of our discussion. Call in your questions at 1-888-376-6225 or send us an email at ask@prairiedoc.org. And we actually have a few questions here, so we'll start tackling away here. So, a Sioux Falls woman wants to know if doctors believe that professionalism can hinder or impact kindness.
Well, I think it depends on how you define professionalism. And interestingly, if you look at medical organizations throughout the country and the world, there isn't a uniform thought of what it is. With professionalism, people talk about things like compassion, integrity, empathy. But kindness, I think, in some ways is more practical and more understandable than these other descriptors. All of us, each one of us knows if she or he has been treated kindly or not. And so that makes it particularly powerful, I think, in the medical setting.
I do know when I was going through training, there was a lot of discussion is it professional to give a patient a hug? Is it a professional to cry in front of a patient, to tell them that you're sorry? And many of those things, I think, kind of at one point were seen as either weakness or not professional. And I think things are, I've prayed with patients. Exactly. I've cried with patients. I hugged one today, when we were discussing a very hard time that patient was going through. So
I remember a nurse told me one time that she was taught you would never sit on a patient's bed to be closer to them, to touch them. And of course, something like that today would be viewed as, well, you do what's appropriate in the setting.
Yeah, so I think what we were at one point thought was meant to be professional was to be, have that emotional coldness or that barrier, or that, I am the physician and you are the patient, and that disconnect where I think now we're learning that doesn't help facilitate healing.
No, and I agree. It used to be medicine was kind of paternalistic. By that I mean, basically the doctor told you what to do, but not why, right? And we kept, kind of the knowledge at arm's length and the patients at arm's length, and that doesn't work. It just doesn't work. It's not for today's age, and it's not a kind way to do it. And if the patient isn't part of the team, then you don't have a team, right? And so I think it's very important. So it depends, I agree, what you mean by professionalism. But I agree also that the dignity of the profession is not the main goal of healing patients.
Exactly. So another viewer made a comment that they wish doctors treated patients with mental ailments with as much kindness as they do to those with physical ones.
That's an incredibly important observation. I mean, any concern a patient has deserves to be treated with respect and understanding. One of the stories I've written about in the past is when I was a resident, a visiting professor came. And most time visiting professors talk about something obscure, maybe what they're researching, and this visiting professor stressed the importance of treating every patient with emotional turmoil and anxiety and depression as incredibly important as a stroke or as a seizure. And I thought that was a great lesson for young physicians to hear. So I very much agree with you, with the author of that question. I think it's very important.
I do too, and I think I had a patient once who had gone through many physicians, or really the physicians had gone through the patient, because it was somebody who never seemed to get better. And the only treatment for this patient actually was to spend time with them. And the doctors were busy. You know, they had a certain time slot and it was just too much. And so by scheduling this patient every single day with me on every single slot, eventually they started to feel better, and I didn't do anything. I didn't prescribe I took that person off many medicines. Mm-hmm. And I thought I was doing a really kind thing, but over time I realized I had begun to really like this person, and that this was an older person that I could really relate to, and someone who was very kind to me, and as we slowly did fewer and fewer appointments. So I think if you're really busy, there's no pill that's going to fix many of these things besides sitting down and, as Jerome has said, listening to their story in depth. And the kindness there is the time that you need to spend in order to make the patient better. Mm-hmm.
Before we started the show, Mary and I all three of us met with medical students or pre-medical students, and we were talking about how receptive many patients are and families to having a medical student involved. And I see medical student involvement as really beneficial for patients, because I think there is more time for a patient and family to get into depth on what's bothering them, what their concerns are, and there's also more time to have an adequate, sometimes lengthy explanation for what could be going on and what to do about it.
Yeah, and I think this viewer's comment is very honest, because I know a lot of patients and a lot of people who have been hurt, yes, but either intentionally or unintentionally by a physician with either a curt word or a dismissive tone, or felt like they weren't heard or listened. So, we as a profession need to be better, and we need to keep working at being better. And I think part of that is also about being kind to ourselves, because a lot of physicians I know will run themselves to the point of exhaustion, mm-hmm, and maybe a little bit beyond that.
Right, exactly.
And if you're not kind to yourself, how can you be kind to the people around you?
It's not a good platform for kindness. If you're exhausted and overworked and tired and have way too many responsibilities, it's not a good platform for kindness. But that's what I notice most, the people who are kind to me, probably. Mm-hmm. So yes. The person who says, I'll take that call for you. Mm-hmm. You just can't believe that somebody would do something like that. When my father was a family practitioner in a small town, and for a while there was a pediatrician there, but he was the only pediatrician, and my father stopped seeing kids, which many family physicians do. The pediatrician was on every night, all the time, and it was just at his wit's end, and my father said, well, I'll start taking weekends for you. And the man cried in his office. Just couldn't believe that somebody would do that for him. So, it's just an amazing world out there.
Yes, and I think medicine is definitely changing from an environment of competition to an environment of collaboration. Mm-hmm. So if you're competing against someone, there is no incentive to be kind.
There isn't.
If you're collaborating with them, we all win together or lose together, then definitely there's a great need and a reason to be kind.
And we try to emphasize that orientation from the very beginning of medical school, that the students view each other as people who are teammates and collaborators and working together and not kind of isolated individuals in competition.
Yeah. So what if, I would love to think that I love every single patient equally. It's kind of like a parent. Do you have a favorite child? No. But some patients, your personalities just don't click or mesh, or you just don't like them, or they obviously don't like you. Is there a way to be kind to them, or how does kindness fit in when personalities are clashing?
This is what is nice about kindness. It doesn't have to be a big thing, right? It's something as simple as, even noticing that they have a new scarf, or that or picking up on something you can agree with, but intentionally trying to say something positive or do something positive for them, I think is what you can do. And it may not be everything that they want, or you may not be everything that they want, but you can do what you can do at that point. And so not giving up and not reacting, I guess, is what I would say.
And oftentimes I find that if there is a time when the interaction is tense and uncertain, probably spending more time than you anticipated can be helpful.
Mm-hmm. Yes. Dr. Holm called in, and he said he would like to know how a student should act when they run into an angry or upset patient.
So this is something that takes experience, right? I think that the student's role there is, assuming there's no immediate medical emergency, is to listen and to try to understand what is said and what is meant. Now, obviously, if you're in an extremely violent situation, that's a different thing. We train our students to respond by getting help and things like that. But if you walk into a room and a patient is very angry that their pain medicines have been stopped, or that they didn't get to go home, or that somebody treated them rudely, the student really should listen and understand, and then I think discuss it with an attending physician and get an idea of how to handle that situation. Some things can't be learned in a textbook, and human nature is one of them. And so learning from the patient, and then learning how things are approached. And sometimes the student may actually be in the presence of someone who is behaving unkindly, a person in authority or even a physician, and then the student has to learn. That's what we call the hidden curriculum. I want you to be kind, but I'm going to go yell at somebody. We want the student to recognize that as a negative role model, as something that they would rather not do in their own practice. So it requires a lot of reflection. We have many reflection activities in the medical school. We have professionalism papers. We have times where students can reflect in an anonymous setting, and when they can reflect, like in the ethics course, in a well-controlled forum that's confidential, so that they can work these things out on their own.
Excellent. All right. Well, I know one of the first things that's always important when I have a patient that's upset is to acknowledge it. Mm-hmm. Say, you seem upset. And either they'll say, yes, I am, or they'll say, no, I'm mad, or no, I'm this. So acknowledge it, and then you can go from there. So, all right. Well, kindness is something you do on an individual level as well as in societal interactions. Nonviolent conflict solving grows from a base of kindness.
Satyagraha Institute is about the training of people in nonviolence as a way of life. We expect kind people to come out of our trainings. At least people who are kinder than maybe they were at some other point. Because they've learned that hate doesn't work, anger doesn't work. A lot of those negative emotions and negative values don't work in the end. In fact, they hurt the person more maybe than they hurt the person that they're angry with. What we try to do is to deepen people in 4 different ways. One is knowledge. So we have Gandhian scholars who are with us. We have people who are trained in Martin Luther King and his nonviolence. And we deepen people's knowledge in the lives and the lifestyles, the ideas and ideals of people like that. The second area is that we try to help people develop their conflict resolution skills. So we do all kinds of activities, you know, where you begin to understand ways you can resolve the conflicts that are better than you have in the past. The third area is deepening people's spiritual grounding. So every day we have a period of inner life where we look at the ideas that come out of different religious and philosophical traditions that can ground us more deeply in some kind of a spiritual tradition. And then the fourth way is we want to build relationships between people, so that if you need to be mentored by somebody, you know that person, you can contact that person. She was telling me about her engagement with somebody who really she seriously disagreed with, and how she approached this person very differently now. Approached him as a person, and was amazed at the relationship that was beginning to develop. It was an honest relationship with two people who had very different ideas about what should be done and what shouldn't be done. And she was really heartened by that. And it's important that we do it, you know, that we speak our truth as we understand it to another person, but do it in a way that is kind.
Well, this is a very fun topic to discuss here. So we've had some really interesting and very thoughtful questions coming in. A female from Brookings just asked how USD teaches their future doctors to be kind to their fellow staff, such as nurses and support staff. And said, I've got an interesting story of an example of what not to do when I was a student. So when I was on, there was a med student, actually there was a resident, that was yelling at the nurse. And he looked at her and he said, "What does it say on my badge?" It says, MD, makes decisions.
Oh my heavens.
What does it say on your badge? This was not in South Dakota.
Oh my gosh.
Not here. So it wasn't here. She said, your badge says RN, reads notes. Read my note and get back to work.
Oh my heavens.
And I was just appalled. I felt terrible. She was practically in tears. I was just heartbroken that someone could be so cruel and belittle and diminish her education and training and her role in taking care of the patients.
Well, if anything like that were to come to our attention, there would be serious consequences for the perpetrator or something like that. We teach we do what we call interprofessional education. Long gone are the days of paternalistic medicine, as we said. We need the team. There is no way that anybody should be disrespecting anybody, let alone a high profession like nursing. These people save as many lives as you will, and there is no excuse for that type of behavior. Not in medicine. They're not anymore. That type of behavior just should never be sanctioned, and it should be reported, and we should do something actively about it. But we do emphasize interprofessional education. So that means not just that the medical students have to be in an environment where there are nurses. They have to actually be learning in nurses. So we have team experiences in the SIM Center where we have nursing students and pharmacy students and medical students, and they run a code. And then there is on the dummy, on the simulated person. And then they step back and they watch the film. And I was watching one of the first debriefs, and the nursing student said to the medical student, "I told you twice that this needed to be done," and the student said, "I just couldn't hear you. I was just too scared." And then they go back and do it again, and they do it again until they listen to each other and they start to act as a team. And that is how we're trying to counter that. There is just no excuse for treating anybody at all with that type of an attitude.
Exactly, and like I said, that was an isolated incident, but it burned into my memory forever of never do that.
No, yeah. Hopefully we don't teach by negative example very often.
Exactly.
But that needed somebody to react
But
to.
I did have a time where a nurse definitely saved me. When I was a student one time, the attending was asking me questions, and it's like being on Jeopardy, only without Alex Trebek. And it was one question after another, and finally got to one where I had no clue. And the nurse was standing behind the attending, poked her head out and mouthed the answer to me. And because it was about a lab that I should have known and I didn't, and I had that deer in the headlights look, and she saved me. And by golly, did she get some extra cookies that night.
I gotta tell you, I mean, I've learned long ago, if the nurse says, I think you ought to go, you ought to go. You ought to come. You just gotta realize that there's nothing about your degree that is in any way superior. It's all about a team.
And they have their roles and their duties. They're at the bedside. They are my eyes and ears. I count and trust on my nurses to tell me when there's something that's very important that I need to know.
And when we talk about kindness, often when the patients relate what happened to them that was kind, they talk about a nurse.
Yes, they're definitely.
But housekeeping, anybody, there's no excuse for treating anybody rudely, and some of the greatest acts of kindness come from people that you work with every day and just don't think about.
Yep, there's a housekeeper at the hospital that every morning I see her. She doesn't speak much English, but she'll say, Buenos dias, Doctora Kruse. And every morning it gives me a big smile. And I love to say, Buenos dias. And I'll say good morning back to her. And it just that little interaction, just that big smile on her face. And she probably doesn't even know how much that means to me to just have her just say hello.
As we were just getting started on this, we were on the kindness thing. It occurred to me that we have several building parties. I don't know why. It's a partying crowd. We have the chili cook-off, the Halloween party, then we have the ugly sweater contest, and it just goes on. It occurred to me that we weren't inviting housekeeping. And they came in at night, but we invited them and they started coming. And it should have occurred to me years ago to do that, but I just didn't. And so sometimes you overlook things that are, that are important that way.
One thing I think we do have to recognize, though, that there are times when people aren't at their best. Any of us aren't at their best. And there are times when a clinician might be sarcastic or arrogant or too abrupt. And I think it's a reminder for all of us that kindness isn't a finite thing that we own. It's something that has to be worked at over and over and over again. And that's something I think we want to impart to our students, too. This is an ongoing effort.
Yes. And medicine also has kind of a black humor sometimes, and people will start saying disparaging things in a humorous way and then take it a step too far. And that's something we have to be careful of because it's not right to do that.
Definitely. So one viewer is wondering, is there ever a time when it isn't fully necessary for a doctor to be kind?
I would say off the bat, no. There used to be an old story that would be asked, would you rather have a really competent doctor or somebody who was just average but nice? And that kind of dichotomy just isn't acceptable anymore. I think we need both. And so I would say there isn't a time, ideally, when any of us should act unkindly. And
being kind doesn't mean that you do everything that's requested of you. If somebody wants a prescription for something that is dangerous or harmful to them, you don't have to say yes, but you don't have to say no in an unkind way either.
Right. So, well, another question is, what do doctors believe makes Dr. Holmes stand out as such a kind physician? He is kind of the paragon of kindness.
He is. He really is. He was one of the first people I thought of when we were thinking of kindness. He's just there. He's present. And if you're talking to him, he's talking to you and nobody else, and his mind is just on you. He sees you, and he still likes you. That's what I like about Rick. And of course, there's so many things that he does that's kind.
Yes.
Absolutely true.
I would agree that singular, rapt, fully consumed attention to you when you're talking with him. You know that he is not thinking of you, not thinking of anything else, not thinking of the next patient, not thinking of the last patient. He is with you now, here. He is present.
The other characteristic I would point out is what a great teacher he is. He's a teacher on this show. He's a teacher to medical students, pre-medical students, other physicians. He has always functioned so well in the role of a wise teacher, and I think there are many of us, many students of his, who are incredibly grateful for the role model he's been in that regard.
And he's just a happy person.
He's a happy
he does
person.
his Snoopy dance. So if we could all learn to do the Snoopy dance like Dr. Holm, that would be it. So, well, Joni, his wife, has a question. She asked if a patient encounters a medical provider who does not show kindness, or worse, shows the opposite, should they be called out on it? And who should they talk to? That person directly, their administrator? Who do we bring these concerns to?
It depends on the level. I mean, if it's a one-time thing, if you just, you know, if I've always been good to you and then I come in and I do something mean and you say, you know, that made me feel bad or something like that, and you feel comfortable doing it, I think that that's perfectly fine. If, however, you don't feel comfortable, most places have an ombudsman, a patient representative. They have offices just for this purpose, and that is available as well to patients. There are many places where patients report. There's also the anonymous surveys, of course, that come in the mail. But if it's something significant, I would hope that there might be an opportunity to actually bring it to the attention of a ombudsman, or to allow if you point this out to most people are good-hearted. And they may not even realize they're doing it. It's a joke they've told 100 times, and they just don't, and they think it's funny, and turns out it's kind of unkind. And so if you just point that out, they stop. So if they can, I think it'd be good.
I mean, this is another value of a team, because if a person who is unhappy or thinks she or he hasn't been treated well, maybe by the physician, might well feel comfortable discussing it with the nurse or with one of the other clerical staff. And to have an organization where there is good communication between all these levels and trying collaboratively to respond best to the patient can be pretty healthy, I think.
Definitely. So let someone know. And then we can't get better if we don't know there's a problem.
Right. It's usually inadvertent. It really usually is. I mean, occasionally it's a personality defect, but usually it's inadvertent.
Yes. So, all right. Well, an older woman from Tabor has had several instances of going to the doctor and being told, oh, it's just old age, and found out that she ended up actually being anemic and felt that she had not been treated kindly because of her age.
Well, it's an important statement, and I think one that certainly any clinician or student would want to avoid. You want to listen so carefully to what the patient's concern is, and then make sure that it's been systematically and carefully evaluated. Now, this is hard because sometimes people come in with problems where there isn't a single diagnosis, there isn't an easy answer. But I think if we let people know we're trying really hard to figure it out and we're going to do the appropriate tests, then it's a lot easier for everybody to say, okay, this is something you just have to live with. But it's a great cautionary story.
Yes, and I would like to say that woman, I'm sorry you experienced that. I'm very sorry that you weren't listened to and that it took longer to find that anemia than it probably should have.
Exactly.
So, yes, we as a medical profession are always working on trying to be better, or we should be focusing on improving and taking a hard look at ourselves and what can we do to be better and how can we improve. And I think sometimes we just so want to have an answer, and sometimes we don't have an answer, and that's an easy fallback.
Right. Well, and it makes us uncomfortable, and so
to say we don't know.
So we say something that is unkind and inaccurate, and as opposed to saying, I worked really hard on this, and I'm sorry, I just don't have an answer.
All right. All right. Well, we have about a minute left, so any last thoughts that you just absolutely have to make sure our viewers hear?
I would say that, and I think Mary, you'd agree, it's really exciting to be talking about kindness because I think all of us recognize how incredibly important it is. I can't think of any physician or student or administrator who wouldn't say, yes, that is a good way to be. But one of the reasons that we are so interested in our kindness project is that this is not something that other medical schools, at least as far as we know, have articulated. I mean, medical schools rather, talk a lot about aspects of professionalism, but to say that it's part of our strategic plan, to say from day one, to say to students and faculty, we want to be kind, I think is an important message.
Definitely. Well, I'm told we have a little extra time, so we get to hear your thoughts as well.
Well, and as I say, we want to make kindness intentional, and this is a work in progress for us. So we need everybody's help with it, and I think there's more to come, and I think it will evolve, and I'm really excited for this project.
Yes, well, you should be very proud of your students. I've had many students in rotations with me, and I have just been so impressed with not only their knowledge and their professionalism, but again, their kindness, of their ability to sit with the patients, hold their hand, answer their questions, calm their fears, and move forward. Because you can cure a patient sometimes, but you can always heal them.
What a wonderful sentiment.
Yeah, so if we are kind, we get to heal them. We may not fix the problem or cure the disease, but there's always an opportunity to heal. So, all right. So we've got another question. A viewer commented that most of us are watching our current or potential patients. I think we're all potential patients. So what can we do to participate kindly in our own health care? Well, I would say one thing that I would think of is realizing that doctors are humans too, that we are vulnerable. Sometimes we respond at the energy that's directed at us. So if someone directs anger, hostile, negative energy at us, sometimes as a knee-jerk reaction, we mirror that back at them. And we shouldn't. We try to be better, try to rise above that, but some days you're tired. Some days you've been up all night. Some days, you're sick. So it's a profession where we're still human too, and I think sometimes patients forget that we have bad days and that we have times where we're not on our best. Because the patient that sees me right after I told someone they have cancer doesn't get the best of me. And I feel bad about that, but that's because I'm still grieving what happened in the room.
Exactly.
From the patient standpoint, I would also say it's okay to ask questions and to want explanations.
Yes.
I mean, sometimes if we're behind and hurried, it might be hard to offer explanations adequately, but patients deserve that. And I think expecting that as a patient is important.
Excellent. And now for the winner of tonight's Prairie Doc quiz question. It is a true or false question tonight. If a physician has great skill and knowledge, is it as important to be kind? True or false? And the answer is yes, of course. Kindness is required to help the whole healing process. After all, it was from Spider-Man's uncle we learned, with great power comes great responsibility. It was Leanne Knutson who answered the question correctly. Thank you, Leanne, for participating, and a book will be in the mail to you soon. We'll be right back after this.
Extra, extra, read the Prairie Doc Perspectives weekly column in your local newspaper. More than 100 newspapers in the region print the newspaper column written by Dr. Rick Holm, covering a variety of medical and health-related topics. Ask your local paper if they carry the Prairie Doc Perspectives.
This week I spent some time exploring the origins of the word kind. It comes from the Old English yekund, or kin, meaning nature, race, family. Another Old English word, kinness, means nation, which I interpret as a subtle and ancient nod toward the kin and kinship in our common bond in support of our country. Modern dictionaries define the word kindness as the quality or state of being generous, helpful, caring, giving. Synonyms include tactful, good-hearted, neighborly, forgiving, and gracious. Sometimes I only understand something when I explore its opposite or antonym. For example, I had to think about mental illness to better understand what mental health meant, about hate to better understand what love meant, about depression to better understand what joy meant. The antonyms of kindness are words like mean, cruel, malicious, spiteful, malevolent, and even despicable. where is the intersection of kindness and medicine? In years past, admission committees for medical school have searched hard to find the very smartest college graduates, and they were able to do it. Certainly, physicians need the intellect to understand the complexity of human health and continue a lifetime of learning. However, we have realized that searching for students by intellect alone might graduate medical school students who don't always develop a good bedside manner and a capacity for compassion. More recently, some of the best medical schools have added kindness and compassion programs to their curriculum. I didn't have the benefit of such a program when I went to medical school. However, over my 40-year medical career, I've learned to recognize the healing power of kindness in medicine. I've seen it in the nursing staff caring for folks living in a small-town long-term care facility. I've heard it from medical providers, nurses and technicians caring for people in clinics, ERs, hospitals, and in hospice programs. I've heard it from kind, supportive friends who have offered or driven me for chemo, for jolly, laughing buddies who raised my mood, from my care team as they gently hook me up for my next infusion, from our kids who call to check in on me, and from my loving wife who is at my side, warming me when I'm chilled, picking up my burdens with unending daily kindnesses as I struggle through these side effects. It's a good thing she doesn't love me for my hair. I am proud that our USD Sanford School of Medicine and other schools of medicine are teaching young doctors that people deal with illnesses so much better when it comes with a generous dose of kindness.
A big thank you to our guests, Mary and Jerome, for volunteering and being kind to come to our studio in Yeager Hall on the campus of South Dakota State University and add their experience and knowledge to our discussion tonight. If you would like more information about this program or to see more episodes, please visit and follow us on Facebook or visit us at prairiedoc.org. That does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Opioid overdoses accounted for more than 72,000 deaths in 2017. An estimated 40% of opioid overdose deaths involved a prescription. Our opioid crisis, next time on Call with the Prairie Doc.
For more than a decade, Dr. Holm, in his role as the Prairie Doc, has emerged as a leader of healthcare education and communication in South Dakota and across the country. Every week, Dr. Holm and other medical professionals volunteer many hours to share science-based truth about healthcare on public television, on the radio, in our newspapers, and online. And best of all, everyone has free, easy access to the entire Prairie Doc library. Hi, I'm Jennifer May of Rapid City. As a board member of the Healing Words Foundation, I ask you to consider making a donation. Please help us continue this important work. Go to prairiedoc.org and make a donation today. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, American Academy of Family Physicians Foundation, and South Dakota Academy of Family Physicians, Black Hills Medical Society, Aberdeen District Medical Society, Brookings Madison Flandreau District Medical Society, Sioux Falls District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Aberdeen Asthma and Allergy, and Swiftel Communications.